This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into Mon Health Talk. I'm Dave Wilson. Our guest this morning is Dr. Stephen McLaughlin, orthopedic surgeon, Mon Health Preston Memorial Hospital. We're going to jump into same-day total joint replacements over the next few minutes. But first, we welcome in Dr. McLaughlin. Good morning, sir.
Good morning. Thank you for having me.
Well, thanks for taking some time. We'll get into the subject matter in just a moment, but I'd like to hear a little bit about you. Tell us about your background, where you're from, and how you ended up with Mon Health.
Well, I grew up in West Virginia. I grew up in Charleston, went to high school there, and then my medical training, I went to college at West Virginia University and also followed that with medical school at West Virginia University. After that, I went to North Carolina, and I finished my orthopedic training there, and I have been in private practice, primarily in Nashville, just around the Nashville, Tennessee area since then, and I've been in private practice for over 25 years. I guess as I got older, our kids went away, we talked about instead of working 70, 80 hours a week, I saw an opportunity here and at Preston Memorial, so I got interested in that and started kind of feeling that way and looking into it. And anyway, we came here about 18, 19 months ago.
And we've had you on the program before, but how are you enjoying it so far?
Oh, I like it. The people are great, and the hospital's been very supportive about what we're doing, and I've had a chance to kind of work with the hospital and kind of getting this joint program together. That's my background. I've done spent a lot of my professional life doing those total knees, total hips. So, they've been very supportive of getting that together and kind of building a program here. And so, we really enjoyed it.
What drew you to orthopedics?
Well, I suppose, growing up, I thought, I always sort of wanted to be a doctor. Nobody in my family, immediate family, were physicians, but did that. I guess I had a lot of orthopedic issues growing up from different sports and a lot of broken bones. And so I had a lot of exposure to that. And I sort of like the positive effects. Something, when you see it, it's broken, and you can fix it. You actually physically do something to fix it and make it better, and you get that gratification. Same thing with joints. Somebody, comes in a wheelchair, they can't walk, and, a few months later they have some procedures, they're getting around doing things, and it's just very gratifying to see that happen.
Yeah, I hear that story a lot. In fact, a friend of mine that I went to school with had a couple of knee injuries, saw the same orthopedist for several years, as a matter of fact, that led him into a career in medicine. Well, we're going to talk same-day total joint replacements today, and you actually have some news to share regarding those procedures and Preston Memorial Hospital. So tell me what's going on.
Well, so as I mentioned, we've been building up a program here, and when I'm up here, we probably do about 4 joints a week, and over the period of time, it's probably been, like I mentioned, 18, 19 months. The hospital's been supportive. We have a special table to do what's called an anterior hip replacement. And I guess over the past month, we did our first 2 outpatient procedures. Outpatient meaning patients come in, they have surgery, they go home the same day. I did not only a total hip replacement as an outpatient, but also a total knee replacement as an outpatient.
And that is significant because, as well as I do, folks have a conception, or maybe misconception more accurately, that to get these kinds of procedures done, if you live out in Preston County or if you live in other parts of the state, you either have to go to Morgantown or you got to go to Pittsburgh or you got to go to Cleveland. That's just not the case. We're doing these procedures right here, not only in Morgantown, but in Kingwood as well.
Well, we are, and I think you have to have a good support system, not only at the hospital, but the patient has to have a good support system. If you look at the percentage, the percentage of total joint replacements, meaning knee replacements and hip replacements, that are done as an outpatient, it's relatively small. It comprises about 5 to 10%, according to a Mayo Clinic article back in August of 2021. So it's still a fairly small percentage, and I think you have to choose and select the right patient so that everything works out well.
So
and you have to give a lot of forethought and things like that in terms of the planning of who is a good candidate for that.
Well, who would be a good candidate? And I want to compare and contrast a little bit, but who would be a good candidate for an outpatient total joint replacement surgery?
I think the things you look for, somebody, number one, who is a motivated patient. They're anxious to get it done. They're anxious to get better. They're a very motivated individual. Somebody who is fairly mobile to begin with. Although they have pain and they have an arthritic joint, they're still mobile and active. Somebody who is otherwise reasonably healthy individual, and also, as I mentioned, has support at home. Somebody who can help them initially in getting up and moving around. But of course, when we do this, we want them to be fairly independent before they leave the hospital the same day.
So what are the differences, or can you compare what I might call a traditional joint replacement surgery with the same-day outpatient procedures? How are those the same? How are they different?
I think in general that the surgery is fundamentally the same. But what's happened over the past several years, and we talked earlier about people having a conception that it's, a long time in the hospital. And you think 10 years ago, somebody might have been in the hospital 7 days. It have been 3 to 4 days. And then, over the past couple of years, it's been overnight, maybe 2 days. But the incisions are smaller. I think we try to be minimally invasive, that meaning cutting less muscle, manipulating less tissue. I think our blood losses are less, and that goes for not only outpatient but also inpatient total hip surgery. The incidence of a transfusion, a blood transfusion, is very small nowadays. I think we're better at managing the pain of patients with anesthesia being more involved, doing different blocks and things like that. So when somebody wakes up, they have longer-lasting pain relief, and there's some things that can be done that can be extended for even up to 24 hours at times. So get over that initial pain, and that helps people. And we try to do that, whether it's inpatient or outpatient. But I think outpatient, we get the patient up the same day. We have them walking, and we want them independent with their physical therapy before they go home. And we're very aggressive at getting them walking, teach them to go up a stair with some sort of assistive aid, but they can get up and down the stairs and move around better. And also, they have no medical issues at all, and their pain is well controlled with just short-term medications.
Do you ever have to, you're talking about getting the patients up and getting them moving, but do you ever have to have those patients, you got to slow them down just a tad and go, hey, not too much too quick here?
Well, yes. I mean, when I mention motivated, some people have the perception that, one, it's still a significant operation. And, they need to have the expectation it's still some recovery. Their body has to get used to this new joint and kind of scar it around it. So they're still going to have some limitations. That being said, I don't really limit them in terms of what they're doing so much. They limit themselves by some of the expected swelling and discomfort that they're going to have. But, they'll get and be a little more active than, there's a price to pay for that. The more you do, you're going to get a little sore, but that's going to go away. That's part of the normal recovery process.
Talking to Dr. Stephen McLaughlin, orthopedic surgeon, Mon Health Preston Memorial Hospital. We're talking about same-day total joint replacements. We got to squeeze in a break. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Dr. Stephen McLaughlin is our guest this morning, Mon Health Preston Memorial Hospital. He's an orthopedic surgeon. We're discussing same-day total joint replacements. And when we're talking about same-day total joint replacements, knee, hips come to mind. Is that the majority of procedures you're doing, or do you offer others as well?
Well, in terms of joint replacement, that comprises probably 90-95%. There are also total shoulder replacements, and those are less common. Those can also be done as outpatient in the appropriate setting and the appropriate patient. But we're also doing here, run the whole gamut of procedures from arthroscopy and sports medicine to trauma work, shoulder work, rotator cuff tears, meniscal tears, and even hand surgery. So
when it comes to
go ahead.
When it comes to joint replacement, is that a like final straw procedure? You've tried other things, or I guess my question is, when does that become an option for a patient to consider?
Well, I first think no. It is sort of what I do is, one, you make the appropriate diagnosis. Somebody has an arthritic that can be treated conservatively. Conservative treatment starts out with what many patients will even do on their own, maybe an anti-inflammatory at home, something like an ibuprofen or an Aleve, something of that nature. There are also different prescriptions of that type of medication. And if there are no contraindications or reasons for them not to take that medication, often that's a good first step. Sometimes people will do activity modifications. Sometimes different braces may be helpful to different patients. And you try conservative things. If that's not effective, they also different injections that can be used. For example, sometimes some corticosteroid injections can be helpful. There is something called viscosupplementation, which is an injection to the knee of sort of an artificial joint fluid, if you will, and that can sometimes be helpful. So we run through all of the conservative treatments that we can do for a different patients. And then the reason, if that's not working and the arthritic change and arthritic pain is affecting the quality of life of that individual patient, that's when you discuss that further options are available and you start talking about surgical options.
Talking to
I think they become candidates when, again, it's more of a personal preference when the pain is affecting their quality of life and it's not responding to other concerns.
Talking to Dr. Steve McLaughlin this morning, orthopedic surgeon, Mon Health Preston Memorial Hospital, talking same-day total joint replacements. And I think in terms of injuries, just kind of the way my brain works, coming from a bit of a sports background, that somebody suffered a knee injury as maybe a teenager or a 20-year-old, and down the road that knee gives them problems and it may need to be replaced. But do you see patients, again, I'm asking to paint with a broad brush here, is it oftentimes an old injury that has to be dealt with later on in life, or can things just simply, your hip wears out over time or your knee wears out over time?
I think it's both, actually. I mean, you have patients who've had injuries or cumulative injuries over a period of years, and I think what happens to somebody when they're 60, it's the cumulative body of work, so to speak, what has happened to their joint. Now, it can be hereditary factors that can cause premature wear of the joints, both in the hip and knee, but also the cumulative, maybe somewhat job-related, what they're doing, how physical they are, kind of the impact and loading of the particular joint. But it's just almost universal. It can happen to everybody. And if everybody gets older, they do exhibit wear and tear changes in the joints. Other way of saying that is the joint's not going to look the same at 65 as it did at 25. There's going to be some wear and tear changes.
And we got to go ahead, doctor.
That everybody's going to experience. That's part of the aging process of the joint.
Talking to Dr. Steve McLaughlin this morning, orthopedic surgeon. Before our next break, and you kind of touched on this earlier, but I'm sure you get this question almost every time you do a consult for one of these operations, one of these procedures. When can I get back to normal activity? So for a patient who undergoes the same-day treatment, when can they get back to normal? Well,
so I mentioned earlier, I don't really restrict people. I want them to get up and move around at their own pace. A motivated person, sometimes you have to pump the brakes a little bit. But there's a process of getting better. Usually, most people by 3 to 4 weeks are walking around and doing most of their things, perhaps driving the car when they're not using any assistive aids to walk with. That's a safety issue, and not taking any pain medications. But usually about 2 or 3 months, most people are going uphill. They're doing most of the things. They don't really feel themselves of having any limitations at that point. And usually about 3 months, release them to go on about their regular activities.
Talking to Dr. Steve McLaughlin this morning, orthopedic surgeon, Mon Health Preston Memorial Hospital. Final break, back to wrap it up right after this. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Just a couple of minutes left with Dr. Steve McLaughlin this morning, orthopedic surgeon, Mon Health Preston Memorial Hospital. Doc, where can folks reach you, make an appointment, or find out more about the same-day total joint replacement?
Like we said, I'm at Preston Memorial Hospital. That number is 304-329-4701, or online, monhealth.com/ortho.
And got about 60 seconds or so here. Been talking about a winter storm approaching. It's snow shoveling season, icy conditions. Just some simple advice so folks may not end up having to come see you later this winter because of winter conditions.
Well, I think first thing, bundle up so you don't get hypothermic or get your body too cold. Make sure that if you get the idea you want to go out and shovel snow, make sure you're in good enough shape to do that. It can be very strenuous, and if you are not used to that type of thing, be helpful. And I think you have to be very careful and cautious. Walking on ice, especially on an incline, you need to slow down and make sure you have your footing before you go so you don't slip and fall. It is very common, and it's that time of year. We do see a lot of people who slip and fall with broken ankles, broken wrists, and that type of thing. So people need to be very careful and just slow down a little bit.
Doctor, thank you so much for the time this morning. I appreciate it. Again, that number is 304-329-4701, or you can go to monhealth.com/ortho. Our guest this morning, Dr. Steve McLaughlin, orthopedic surgeon, Mon Health Preston Memorial Hospital. Appreciate it so much. Thanks, and we'll talk to you again soon.
Thank you very much.
Absolutely. Again, Dr. Steve McLaughlin, orthopedic surgeon, Mon Health Preston Memorial Hospital, and you can find out more information about same-day total joint replacements over at monhealth.com/ortho, or you can call 304-329-4701.